Okay.
And Lamont is going to join us as well.
All right, we're live.
And Lamont is going to join us as well. Good morning, everyone. 8:03, we'll call the meeting to order. This is Deanna Diamore, the Health Director for the City of Norwalk. We have Dr. Norman Weinberger, Board of Health member, Ken Lalim, board member, and Terry Quell present. We also have Teresa Argandazzi and Megan DeMeglio from the Health Department staff on as well. And Larry, I don't see any attendees right now from the public.
That's correct.
Is that correct? Okay. So can we look at the first agenda item, the approval of the May 26, 2020 meeting minutes? Everyone has an opportunity to look at them.
I'll move the minutes.
Thank you, Terry. Do we have a second?
Second.
Any comments? Edits? All in favor?
Aye.
Aye.
Minutes pass unanimously. Thank you. The first item on the agenda is second item on the agenda is public participation. And again, Larry, there's no one here, right? So no one has public comment.
There are no public attendees.
Okay. So the third item on our agenda is racism and health inequities. And just for the record, Lamont Daniels also joined the meeting too. He's on. So with everything that's been going on, with George Floyd, with the protests, it reminded me that, the Health Department has really made a commitment to health equity and to look at the social determinants of health and to improve the health status for all our members of the community. And, public health is all about creating the opportunities for people to be healthy. And it just got me thinking that, even with our accreditation, we have all these requirements for health equity and social determinants of health, but we don't talk about racism that much, and it's in and of itself as being a health issue and its impact on health. It's implied when we talk about health equity, but it just got me thinking that, I really would like, to talk about this with you all as the board and to talk about health inequity and just wanting you to, always encourage us to do more and to do better. We're always trying to constantly improve what we do. And so, you think about racism, not only just personal racism, but think about structural and institutional racism. And, Teresa and I and Lamont, we've all been talking and, I've just been thinking like, our workforce development plan, we should have a training on institutional structural racism that all staff should participate in. There's things that we could be doing more. We think about just the systematic policies and practices within institutions, within our past that have disadvantaged people of different, race groups, different people of color. And I guess I'm asking, to talk about this more and just ask you what you think we could be doing more and push me to do more. I'm asking you to do that. And, and ask you if we want to make a statement, if we want to, put down some ideas for how we want to just continue to do better. And Teresa, I want to look to you just to, if we could just talk about a little bit about what we already do in terms of health equity and the social determinants of health. Think about the different projects and initiatives that we lead with community health improvement. Can you just talk a little bit about that?
Sure. So, where to begin? So I think that one of the biggest things that we try to do to address health inequity is to address the social determinants of health. So whether we are, creating specific interventions about those social determinants, like the food access work that we're doing to increase food security in the city, work that we do to talk, with our housing partners and to ensure safe and healthy housing, or if it's, considerations of the social determinants while we're developing our other interventions. So, just general health education information, we're constantly looking at, are we just providing information, or are we addressing some of the community barriers that are keeping people from following certain health recommendations? So we really do address we're trying to address the social determinants as much as possible, but racism really is a driving force behind the inequities in those social determinants. So it's kind of like we look at the social determinants as root causes of health, but racism is, a root cause of those inequities. So Deanna and I were just trying to think through, how we can be anti-racist as an organization, and different, actionable steps and concrete things that we can do to help address it in the community. As far as from a health perspective, really it is the one of the things that we could do as upstream as possible to help impact health outcomes downstream more. But it is difficult, when you're looking at some of the thought leaders in this area, to find concrete actionable steps to take, right? We can talk about it, we can say that we want to be that we want to address the issue, but to find concrete steps. And so we've done a little research and found a couple different suggestions from Robert Wood Johnson and the Pew Charitable Trust and those kinds of places. But still just trying to figure out how to operationalize some of that stuff, and any thoughts or suggestions that you guys have would be incredibly helpful.
What did you guys come up with as one or two things that you can actually put in an action step?
Well, a couple of the things are, one is around data. So we've seen a lot of organizations suggest that, you have to really understand the community and inequities between different groups to be able to address them properly. And so one is a commitment to comprehensive data collection and analysis so that you can disaggregate things according to different socio-demographic factors, which is, that's a real challenge. It's a heavy lift for a local health department, but we have some in-house expertise and are looking to develop in that area. Another is around, involving the community in our work more. So not just, we strive for community engagement, but often that means, I heard someone on a meeting recently call us gatekeepers, right? So we're representing our clients and our community, but we are still the gatekeepers to the information to clients. So getting community members, actual residents who aren't involved in public health or other partner agencies, and more involved in our work, and getting their feedback more so that there's more representation from the community. Those were the two big ones that I can remember. And then advocating for larger policies and systems changes. But Deanna, can you think of anything else that we talked about?
Recruiting staff and partners who reflect our community, our diverse community, but then also thinking about the policies and systems and procedures. I think about, an analysis and look at the policies and practices and procedures with that lens too, and thinking like the current ones, and then any, decisions moving forward, making sure we continue to have that lens as we look at it. And just be vocal and be voices, and talking about the impact of racism on public health, and promoting, like Teresa said, anti-racism amongst our staff and our partners, and just, talking more about it too.
Have you come up with a statement of any kind internally? I thought I saw something that you.
Yes, we have a draft one that we can circulate.
And who was involved with putting that together?
Right now, it's just Teresa and I, and so it's just at the very beginning of it. So we want your input on it. So
I have a couple of different places that. So I have a board of directors, which is 16 CEOs of all the community health centers in the state, and I went to them and I was like, you must all be doing something in your own organizations. How would you like to roll that up? And they were a little reluctant to, because they come from all different parts of the state, lots of different cultures. Some are, it's geography does matter kind of thing. So it got pushed up back to us. And from an employment point of view, I got 23 employees. And so we decided to have it come from the employees, because employees started asking questions about, what are we doing and all the rest. I was like, if you all want to join build a team, to address this issue and really address and see if you can gain. So we got about 5 employees that wanted to do something. So we gave them the forum to do something. We helped them craft words and a few other things and ideas and those kind of, and wanted to, so that became our first action step, actually became the employees engaging in the development of a statement. And so it was practical, because I mean, it is the hardest thing to say, we're gonna, do X, Y, and Z, and doing it, you have to have something that lasts. You have to have something that, lives and breathes and all the rest, and somebody can touch it. And so this became, all of a sudden, I've got 10 people on this small committee of, it's half the staff, but half the staff is now contributing to this living document that we are agreed to. Every 6 months, we're going to update this and make sure it's still reflective of the culture of the organization. So it's a real small step, but I think it's a really important step, because it is engaging people in a process that they feel they have a little bit of control over. And everything else we all do, I think, is very difficult, because we don't have a lot of control over a lot of aspects of what we all do. So that has worked very well for us as a company, and it's really been reflective. We now are starting to put that into all our grant applications, that there is a reference to, basically social injustice of some type in there, that it can be recognized. And so you're starting to see all these different areas that we're starting to touch, and it's incremental and it's really slow. But I think that if you can build it that way, it'll stick, and it'll be tangible and not just a theoretical, yes, we're against racism, so I don't know. So that's what we've done on a small scale basis.
Thank you, Ken. That is such great advice and guidance for us. I love that. I just love that. Thank you.
Yep.
I think that's a good option. And I think we could also go back to our mission statement and philosophy that we do every couple of years and see if that, I think some of that's there. I'd have to look at it again, but maybe we need to take another look at that with this different lens now and update it. And we're going to have to do that. We have to do that periodically anyway. So we're probably about due to do that. No?
Mm-hmm. Yes, we are.
Yeah. So that might be a good way. And that does incorporate the staff. So that would follow right along with Ken's suggestion, because we have board members and staff members involved in that process. So that could be really very helpful.
Thank you, Terry. That's great.
What about making a recommendation back up to the national, national association that's doing all the accrediting, and make it part of the accreditation process, that some type of reference, I don't know if they want to define it very well, but some type of reference that one exists, that a statement does exist to address this. Because the hardest part of all these social things that we're talking about, no matter what time in history you look at it, it's how does it become sustainable? This has been going on for hundreds of years. This isn't new.
But, and part of the issue is these are policies that end up being political issues. And I think we as a health organization have to put that up in front. People have to understand that zoning is a political issue, and it affects people's lives. And I think that's a health issue. So I think we have to stand up and, when those things happen, speak out.
Thank you all. I'm taking a lot of notes right now. This is really great feedback. Again, thank you.
I'll send you our statement,
Yeah.
so you can see what we did. It's on our website if you ever want to take a look.
Okay.
And we've been encouraging all the health centers to put theirs out there in front and live it, find a way to make it live within the organization. So we never did one as the aggregate organization, as the association yet, because that one would require getting 16 CEOs to agree to something. So
Well, I find it interesting, Ken, that what you said, that there's such a diversity among the different health centers based on obviously lots of issues.
Lots of issues. Yeah. But many of them they can agree to. I mean, some of these core issues, when you talk about burying, or bringing your mission into this process, not that it is the process, but it is incorporated
Right.
somewhere in there so that you're still reflecting what you've said to the public for years. That statement still breathes. So that's another piece that works.
Thank you, Ken. And Lamond and Megan are also on. I just want to give them the opportunity if they want to add anything to the discussion. Megan, you're muted.
There you go. I think what Terry mentioned about our strategic plan and adding that piece to it would be a great area for us to include the staff and have them, take the time to reflect on that, as well as adding training to our workforce development plan. That was a great idea, Deanna. So those two things, yeah.
Thanks, Megan.
I do feel like we're a bit ahead of the curve of maybe some of the other towns and cities around us, because I think we do a lot of work in the community, not only the health department, but the police department has community policing, and lots of other agencies really reach out, the housing, the seniors. So I think that we already have a presence, not only Board of Health, but other agencies have a good presence in the community. So I think that is a plus for us, that it makes it a little bit easier to move into the community and bring more folks in to work with us.
Absolutely. And, and it's really exciting that the mayor and the common council, with the reorganization, created the community services department and added Lamond's position on the chief of community services. And so I think all of that is only gonna, really, really help us continue to focus more on the community and make sure that we're serving them, and certainly will help the health department as well. So. Lamond, anything to add before we move on?
No, thank you. I think what's important, you kind of alluded to it, is, looking at some of our other neighboring communities, or Teresa, I know you mentioned Robert Wood Johnson. I've done a lot of work for them in my previous work at the Aetna Foundation. So there are models and approaches or things that we can challenge ourselves based on what other folks are doing across the country. So I think it's just having that ability to learn from our colleagues across the country can be very beneficial for us here in Norwalk. And I think you're right, Terry. There's definitely great things that are happening, but I come from a position of there's always room for improvement. So to Deanna's point, continue to still challenge ourselves. What can we do more? What can we do better? I think the other piece, what I've learned and observed here in Norwalk, is perception. I think we can all agree people's perception is based on their rallies. So how do we engage the community in an authentic way so that we know we're doing a good job, but for some reason there's a disconnect. They don't see it that way. So how do we bring in real people to the table? Not just professional parents, but parents who are really walking the walk, talking the talk in one way or form, to really learn and hear. And, we used to say oftentimes, did we get it right? Did we get it right? I think I got it right, but you don't really know until you walk the streets in those communities. They'll tell you. I've been fortunate when we were doing a lot of the food work, walked in a couple of communities in Norwalk, and you do get a different perspective when you're talking to residents in their neighborhoods on their porch saying hi. So I think we can continue to find those opportunities to really engage, and not necessarily in our buildings, but where they live. I think we'll learn a lot more of how to even strengthen the good work that we're already doing. Thanks, Deanna.
Thank you, Lamond. All right, so we have our homework for us. Thank you all for your advice, your guidance, and we'll come back at the next meeting with our progress and what we've been working on, and a more, I don't want to overpromise about, we'll see what the employees engaging them, or we're very busy right now with COVID, but we'll give you an update on where we are with this in terms of, you know, engaging staff and thinking about the next steps. So thank you.
Dan, do you have any committees that involve the general public?
Teresa, do you want to talk
General
about?
public's piece of this? How do you get them engaged in a portion of this? So it's not the health department's statement, that it's the general populace's statement. It's real people making this. You know, I don't want to sit here and pretend I know what's going on in every aspect of the city, but the citizens do. And I'm just wondering if do you have any place that already exists that you can plug into, or would you have to create something brand new?
Let me just quickly, Teresa, because there are a lot of things that the public, because this is public, right? I can't remember.
Yeah.
So I could say that stay tuned tomorrow.
Okay.
We are preparing to make some significant announcements of kind of what does this look like in Norwalk, because we do believe these are some defining moments in our community. And so stay tuned tomorrow to look at that. I can say, because the mayor did share this publicly, there was a document that was written many years ago. And one of the things the mayor committed, it was a Blue Ribbon Commission, Ken, on race relations that the mayor, I don't know, I met many people in the city. So I met someone that was here for 25 years. So they may have, you know, I don't know. What the mayor committed, you know, we need to look at that and maybe use that as a framework to move forward. And so there is some things that the city is preparing to announce tomorrow, and there most certainly will be a health component, because in this point we can determine what this looks like in this kind of, in my opinion, this new era. I think we're in a new era around how we do work and how we work and relate to communities. So so I just wanted to at least pin that, and then go ahead, Teresa, you can share some other things, but it will be a larger city approach to how we look at these issues in a real way. Hope that helps.
And if I can just say in terms of community engagement for other topics, you know, we've had varying levels of success. The health enhancement communities work is one area that I think we have done a pretty good job of getting community members involved. Although we still have more work to do on that. But I think one thing that we've learned is that to Lamont's point of, you know, not just bringing folks to our table, but to going to where they are and to meeting them where they are is really essential. And then something that I've really gotten from the health enhancement communities is you have to make it's hard work to get meaningful engagement, because you have to make some serious changes to the way you do business. You know, that means these large committee meetings are happening in the evening now. It means that you might have to think about childcare and transportation and language. And, you know, first and foremost, something I really strongly believe in is compensation. So, you know, many of the gatekeeper people that we are around the table with are being paid for their time to participate in these activities. And so, you know, the health enhancement communities work has allowed us to, you know, provide our community representatives with the same, you know, with compensation for participating. So, you know, there are some things to think about in terms of equity when you're trying to engage the community. Is it's not just about finding someone who's available for a meeting at 10 a.m. on a Wednesday. It's about rethinking the way we're operating to make sure that community members have the capability to participate in a really meaningful way. And that's really hard. It's really hard work. But what we found through the HEC is that it's really worth it. You know, it's that hard work really pays off, because the end product is so much richer and it serves the community in such a better way.
Thank you, Teresa. Okay, so any other comments, questions before moving on to COVID? Okay, so we continue to see the decline in the cases. you know, I usually get 1 or 2 positives, new positives a day. And so we're hoping that that continues. The governor yesterday released new, you know, his updated figures for the hospitalizations. And, you know, he announced yesterday there were 140 people in the hospital across the state. And if you compare that to where we were at the peak, there were almost 2,000 people in the hospital. So we're seeing some really great progress in Connecticut and the surrounding states. We are closely following what's going on in some other states and around the country where we're seeing the increase in cases. And it just proves the case even more, the importance of the physical distancing and wearing face coverings and masks in public, and to really make sure we stay on top of all of those measures that we know work and stop the spread of the disease.
Does it bother you guys as much as it bothers me that I still see so many people unmasked?
Not only does it bother me,
Social distancing at all?
well, it's two things. There are lots and lots of people have a mask on, sort of, and it's not appropriate. It's, around their neck. It makes me crazy. And if I'm out, particularly if we're going someplace, usually in the car, I want to stop and roll my window down. But put your mask up, stupid.
Yep.
And on Saturday, right across from City Hall, there was a whole group of people without masks, carrying signs about open up. This is a free country. Open up. So I did stop, and my wife was sitting next to me screaming,
"Don't do it, right? Don't do it." No, just you know, when you see the results that it can have with what we've done, to think that we can control this through public health for the vast majority. I mean, obviously, even with it, you know, if we get there and we get a vaccine, I mean, that's still only going to cover some percentage of the population, 50, 60, whatever it is, you know. So I think we're here for a long time, and people need to recognize that this is just part of life, that while we're coexisting with bugs, you know, this is how you beat them. And it's, you know, we all have those decisions to make every day. And if, you know, I don't know, it bugs me that people don't take it a little bit more seriously. So
I absolutely agree with you. Absolutely.
Can't change the world. You got to change a little piece at a time, right?
You know, we keep thinking about, like, how can we get creative with communication, how we can keep pushing the messaging about the importance. And so, you know, we're certainly not going to let up on any of that, and we're going to continue to push those messages and recognize that it's a learning curve for people, and it's a cultural change to being, you know, wearing masks. People aren't used to it, but yeah, absolutely, we need to continue to have those messages and to show that the masks work, and that's just the new normal now. We need to be doing that.
How about, like, community leaders making it to the front page of the paper instead of what we see on the front page of the paper every day?
I think
always negative, just negative.
I absolutely agree with you, Ken. I think that's a big part. Leadership leads, and if it doesn't lead, we have these catastrophes.
Let's see. We have a very senior person in administration in this country that won't wear a mask. I think that is an absolute statement that is just, you know, I think it's just wrong. You know, that can't get any wronger than having your president refuse to wear a mask. That just drives me crazy. No, anyway, we won't get political here.
I was just going to say, enough politics.
That's right.
Can we just thank our mayor for recognizing how important?
That's the kind of stuff I agree with. That should be on the front page of, you know, Harry.
How lucky and fortunate we are to have the local leadership.
Yep.
That's what we got to rely on right now.
Right.
Yeah.
Well, and you can see the effect across the country. Places that have leadership, particularly here in the Northeast, where it was such a disaster, were able to bring it under control because the leadership sat on it.
Yep.
Worked hard to make sure that everybody understood what was going on.
Yep.
So applaud our leadership.
Yes. So we continue to you know, move forward with the contact tracing. So the state has their software system, and we're using it. And Teresa and Megan have been and Darlene have been the ones to really spend a lot of their time with the system and getting acclimated to it. We have 2 staff members who are doing most of the contact tracing for us right now. We have a set of volunteers. You know, we've had the school nurses, and we had emergency response team volunteers who were helping us for a while. And we also now have people who are reaching out to us saying they want to volunteer moving forward. So we're continuing to work on that whole system. The state did announce to us last week that they wrote in an application to have funding for local health departments specific to contact tracing. And so there will be money earmarked to local health departments in Connecticut to pay people to do the contact tracing. So it was really great news to hear that. We don't know the exact dollar amount yet, but I think it's with it like over the next 30 months to have funding for contact tracing specific to local health departments. And they're also looking at additional money to communities that have been impacted harder, that have, you know, higher poverty rates, where people are more susceptible to having higher case rates. So really, really happy and excited about thinking about that, you know, more funding coming to local health departments for COVID-19. The state is working on a system as well to have it so
Deanna,
that, you know,
how do you get your referrals into the system? Or does, you know, is there a policy on how you receive that? Is it just known in the medical community, that, or do you get it from the state?
So we get it from the state. So it's that the contact tracing software is linked to our electronic disease surveillance system. And so when the providers and the labs report to the state, that gets into our surveillance system. All the local health departments have access to that. You have access to the cases in your jurisdiction, and then that's linked to the contact tracing software platform. And so the idea is that we have a statewide platform where local health, like, so let's say we have a positive case in the neighboring town, and there's a contact with that case who lives in Norwalk. So the whole system is speaking to each other. Whereas like in the beginning of all of this, if we got notified of something, you know, let's say somebody in Wilton, we would have to, you know, call Wilton to say we have a contact, you know. So this is just, it allows for better communication, easier communication across jurisdictions. They're also working on a notification system so that if someone sees a phone call from like this number, they'll recognize it as coming from this statewide system. Is there anything you want to add, Teresa, about the contact tracing?
No, I don't think so. I mean, there's a series of additional comprehensive trainings that they're doing this week to give us some additional, you know, walkthroughs of the system. They're consistently making changes, you know, in response to local health departments' requests for, you know, small tweaks in the system to make it a little bit easier to use. And so they've done the majority of those tweaks at this point. And so so they've decided to do another round of trainings. And so I'm going to do one this afternoon, and I think some other folks have signed up for others. But Megan has done a great job of assembling a list of the folks who have offered to volunteer, and reaching out to them and suggesting that they take the Johns Hopkins course on contact tracing that's online and available free, as a preparation if they're interested. And then she's, you know, developed a whole suite of onboarding and training materials for them, so to become more acclimated with the health department in general. So Megan, I don't know if you want to talk about that at all.
Yeah, so like Teresa said, I reached out to a lot of the volunteers or people that had reached out to us interested in contact tracing, and just kind of let them know where we are, that we haven't forgotten about them, to take that online training to prepare themselves. We also just made it clear that this right now is a volunteer contact tracers that we're looking for. So just to put that out there to them. And I compiled a HIPAA training and confidentiality training. Actually, Deanna and myself put it together a while back, and I looked back at it and I thought it was a great presentation. So thank you, Deanna. So we're going to use that, and as well as just a guide of all types of resources local resources that if a contact tracer was speaking to somebody and they had questions about housing or food, that they would be able to look at this guide that we put together and find resources, local resources for them. And not just tell them to go to a website or, so that we could actually give that to each of the contact tracers so they have all the resources with them when they're doing these calls.
How many people do we have in active tracing?
We had 7 new cases last week and 8 the week before, so about 15.
And you get, and their objectives and all the information we provide has been that they're following our suggestions and actually eliminating this process. I mean, is it working?
Is the contact tracing working?
Yeah. I mean,
Yeah.
It's supposed to be to a point where you've got an endpoint where that whatever group you've got no longer has disease, right?
So we're finding a lot of the contacts have been household members. So we haven't had to do a lot of, following up and finding people because we've been able to, communicate, through the household. We do get concerned though with the reopening, what that looks like moving forward. We know that's not going to be the case moving forward. So that's been what we've had so far. We do. We also, we've read about like some of the other communities where it's hard to get in touch with people. It's not going to be 100%, and we know that. We know that it's not going to be 100%, but it's, whatever we do, we know that it's going to make an impact, and we're going to just keep trying to reach people, and we're hopeful that as we move on, that we'll continue to make improvements with it. But we're not gonna, it's hard sometimes to it could be challenging to get all of the contact information for everybody. If it's outside the household, it's more challenging with that.
We're hearing from, like Deanna said, from other communities, and you may have, if you've paid attention to if you've watched a couple of the governor's press conference, we understand it may be statewide. It's challenging to get people to share information about their contacts. And so I know the governor's office is planning a publicity campaign, PSAs to encourage people to participate. That's part of the reason that they've developed like a common caller ID system, so that when a contact tracer calls someone, it will look the same on everybody's phone in the whole state. So that will help, so that people recognize and aren't suspicious of the call. But I think it is going to take a lot of public education to encourage people, similar to mask use, why this is important for protecting the community. And so we're, we were waiting for some of that final information to come out, but it is going to be something that we're really going to ask our community messengers and our trusted community leaders to really encourage people to participate and ensure them that that this is important for protecting not only their health, but the health of their friends and their family, the people that they spend time with, and the rest of their community. Because you're right, Ken, if we're able to do it comprehensively, it should, and provide people with the support they need to follow those recommendations, then it should really slow any kind of spread. The key is getting people to participate because it is a voluntary program.
There's a lot of discussion about apps for contact tracing. There was an article in Science looking at the quote best ones around. Is there some discussion locally or in the state about doing any of this?
I haven't seen anything. Have you, Deanna?
No, not anything beyond like the system that they're using currently.
So the contact system that the state has stood up does allow for automatic communication, so that once you contact a case, they can opt to get daily text messages or emails instead of having a contact tracer call them. And so in that way, there is the option for automated communication, just as check-ins, to make sure that they're not symptomatic, or that they're recovering and they don't have any problems. but I don't believe that they've talked about using an app just for contact tracing.
Okay.
So do you guys work with the community health center on if it's, if it's a patient, would you know that the patient started there? Because there's a meeting of the CMOs from all the health centers around the state that gets together every morning at 8:15 for 15 minutes and talks. And they're, obviously this is a topic that they bring up about, do community health centers take the lead on this? We're trying to find our place, if you would, in this process. And we know that there's ultimately the state's, the responsible party at the end of the day, because it's going to be, that's going to, I'll say it could be mandated. So I'm just wondering if there's a different relationship when it's somebody that's at the community health center that they're notified. Is that something that they bring to you, or do they plug it back into the system, the larger system?
Most of the providers report to the state. There's an online portal where they report, and they're able to.
You're getting it through the state, not necessarily from across town.
Right.
Okay.
But we can see who the reporting
Right.
provider
No, I think it's
is.
appropriate that it goes that way, because you start messing with the process and then you get 150 different ways of doing it, so.
Mhm. Wanted to just give an update too on testing. So the Community Health Centers Inc., the Day Street Community Health Center, has testing available to their patients and community members Monday through Friday from 9 to 1 at 49 Day Street. And they also have been partnering and working closely with Lamond and Teresa and others to look at testing sites in the community. And so they had a testing site at the library last week. They had over 100 people attend that to get tested. And they're encouraging everyone to come get tested. You don't need to have symptoms to get tested. You don't have to be contact. They're just trying, to help increase the capacity for testing within the city. They're also partnering. Lamond, I don't know, do you want to speak about more of this, or do you want me to give more of the updates?
If you don't mind, I'm tending to family matter. Thank
Okay,
you.
Okay, yeah. So they're also partnering. There's a site at Rudner Court, partnering with the Housing Authority, also St. Paul's Church, the Norwalk Senior Center, and so they're doing the testing at the community health center as well as going out into the community to get more testing available. And so they're asking that people register beforehand, but again, they don't have to have symptoms to get tested.
You don't happen to know who the medical person behind it that is signing off on those? Because there's this controversy back and forth at the state level about whether, who can order a test. And at one point they said, you don't need to have an order. Anybody can just walk up and do anything. But then the labs were getting upset because they didn't have anywhere to send a positive test. Who ordered this thing? They didn't find that out. So there's got to be a professional. There's got to be a provider at the other end of things that they do. So they're taking on that responsibility.
Yes, they are.
Mm-hmm. Yeah. And it's been very successful. We're going to be going into the Norwalk Housing Authority complexes. Actually started this Monday. We're going to be setting up a pop-up at a few of the houses of worship. One is happening this week, and our senior center. Day Street have already done many of the larger senior programs, exclusive for seniors, but the senior center one on Allen, that one is also open to the public. And I was there at the library. I actually got tested. It was very unpleasant in my opinion, but it was so important. And so that's really the message when we're working with some of our the NAACP. We're having a conference call in the Norwalk Hispanic Chamber to encourage them again, kind of really being inclusion and really having those individuals work with us. How do we message and frame? Because I think someone was saying when I was, I don't know if you all know, I'm my wife, she's in like early labor. So, I mean, she's fine, but so that's why I'm kind of moving back and forth. And we have a 6-year-old running around the house, but she'll be leaving shortly. We're going to execute our plan. We'll see how effective it is. But so now I lost the point. Oh, yeah. So we want to encourage testing, especially in light of the beautiful weather, the reopening. And so we're hopeful that working with folks in Norwalk that people can trust. I think that's the point we want to elevate. Trusted organizations saying testing is good, you have to get tested. I think we're going to hopefully see continued testing in our community.
Thanks.
So I have a question following up on that. So for many people, we've been hearing, or at least I've been hearing for quite some time, if you don't have symptoms, don't go get tested. So now that language has changed over the last few weeks. So what kind of education are we doing to help people understand why they should go? Like, I've not gone, I've never had any symptoms. So what would be the advantage for me to go to either me, my family, the community? That's a message I'm not sure is getting promoted right now.
Yeah, that's a
Where
great.
would you go?
Yeah, that's a great question. And in the conversations we started having with some of the organizations, I think it's because of the asymptomatic, you don't know. And I think the other piece is, to Deanna's point, that, the contact tracing is more in the household. So if I'm a young person and I can be asymptomatic, but if I live with my grandmother and I pass the virus may look very different in grandma than me. So let's err on safety. Let's take care of loved ones. So we're trying to create some message. Take care of your household. Get tested. We're trying to be creative in that respect, Terry. But that really is the message around. You may not feel it. You may not even think you have it. But for the benefit of your family and your household, especially for those who have family members in the household with compromising, whatever the case may be, it'd be critical because the virus can turn very differently on those who are at risk.
I think too, like with the reopening as well, as more people are out, and so it's even more important to know your status, to make sure you're not an asymptomatic carrier. But I agree, Terry. We should be doing more messaging around that too. So thank you. Just a couple other things. The governor talked yesterday about possibly having a regional approach to quarantine if you're coming from other states where there's higher case rates. So he hasn't made an official announcement, but our governor and Governor Cuomo and others have been talking about that as a possibility. And we also are continuing to work on the reopening for phase 2. The swimming is now allowed at the beach, and so we're back to doing the testing at the beaches that we normally do for water quality every year. We've been working closely with other departments on the outdoor dining, getting the salons up and running, the indoor dining. So the health department continues to be very busy at the different phases of the reopening. The governor has said phase 3 possibly mid-July, but not definite yet for sure. But again, we continue to keep a close eye on everything and continue to help these businesses that are reopening, making sure they're following the guidelines that the state has set.
So is the health department actively involved in policing this whole thing?
So we're in charge of the facilities that are called like a public health facility. So any of the restaurants, the salons, that's all under our jurisdiction for enforcement.
It's a job that's exponential. I don't know how do you keep up with that?
I was going to ask the same question. How do you have personnel to be doing that?
So for the outdoor dining, we increased, sanitarians have been going out at night to do the inspections of some of these facilities, the restaurants, because we know they're more active at night. But yeah, we've been fortunate that it has been in phases. So like we tackle one and then the next one opens, we move to the next one. But for sure, yeah, it's on top of, septic work that still is continuing. That is not, it's not to do with COVID. It's just housing inspections and addressing those concerns. So yeah, the health department.
And we look at the community health centers in the state. they're doing an enormous amount of this work in this space. But by the way, they have 400,000 patients they were taking care of yesterday that still have to be taken care of for their diabetes and their hypertension and all the things we've kind of forgotten people have. And it's been made up with some telephonic orders and testing and telephonic assessments and all the rest. But still, same thing. You're still doing your day job, and now here's a nice pandemic on top of that for you. So.
Yeah, it's been.
Well,
really
I'm glad the community has been responsive to the changes and not trying to get around everything and have you have to police them. So.
Any other updates or questions related to COVID? I did want to mention for flu updates, we have a team of staff that are working on putting a plan together for a drive-through vaccination clinic for flu. And so they've been actively working on that and meeting once a week on it. So we continue to work on that. And then we've been heard from several of our partners like the hospital, the community health centers, about just a citywide strategy for flu immunization. So that's something we're also thinking about and getting a group together to talk about that, because we know flu vaccination is going to be even more important this year. So like, another thing for us to be working on, but it's so important. We've got a great city, so we're really fortunate. We got a lot of great partners, and I've got an awesome staff. Teresa, Megan, they're the ones, and with Glenn and Darlene and Pat, they've been working on the flu clinic model. Anything to add related to flu? No?
Not really, just planning. It's been fun thinking about other ways to do our traditional flu clinic and like getting into like emergency preparedness and using those plans that we've spent so many times drafting and reviewing. So I've been having a good time with Glenn looking through those.
Love the positivity, Megan. And then, so I just wanted to mention, WIC continues, so talking about operations, WIC continues to operate remotely. Darlene and her staff, they've been working on a plan for reopening. Eventually, when we have the public, we have clients coming back in person, and what does that look like, and how do we protect them and the staff? So they're working on that. They're also thinking about starting to reopen the clinics, and first would be the sexual health clinic, and that would be on a limited basis and by appointment only. So this wouldn't be till further on in the summer, but they're working on that. The clinical staff is working on what that looks like.
The program still being run by Optimus, is that correct?
Yes, it is. Yeah.
And that's been going fine?
Yeah, Optimus has been really great.
There you go, Norma. I give you the shameless plug. There you go.
We love our community health centers. Any other updates before we wrap up? I see Dr. Karpiak is on as well. I know she's been on the whole time.
Good morning.
Good morning.
Well, thank you. That was a very comprehensive update. So
I'm glad. Thank you all. I'll always love your insights and your guidance, and advice. Appreciate it.
keep up
All right,
the
so
good
then
work.
we'll adjourn at 8:56 then. Thank you all.